The sales process is simple. Everyone's will look different, but if you follow these guidelines, it'll be almost impossible not to sell. Refer to Victoria's link of how to specifically find private practices that bill Medicare, or simply Google wound care clinics near me and be sure to qualify the practice yourself. Look up outpatient wound care clinics near me. Be sure that it's a private practice. If it's an affiliate of a hospital, they will not get reimbursed. If it says something like Buffalo Wound Care and Hyperbaric Medicine, that's a great place to start. Call them up and say, "Hey, I'm Ashley with Dermablind Placental Graft for Wound Closure. Dr. Smith treats wounds, right?" "Okay, great. And just checking, you guys can bill Medicare?" "Perfect. Just had to check before we wasted any time. I'm free next week on Tuesday to bring lunch for the office. Which day and time works for you?" If they say, "We already have a dermal graft," say, "Great. I bet it works awesome, and I'm so happy he's already treating with an allograft. I think he'll really want to hear about the reimbursement of ours. It's a little different to bill, and it's one that might make more sense to the office while providing the same care to your patients, if not better. You want to hear about it?" If they say, "We send our challenging wounds to the hospital," which frequently wound care centers will do, you can say, "Any interest in easily healing these wounds at the office and reimbursing for more money to the practice? Just one meeting will describe how to do so." If they say, "We don't use any allografts," say, "Awesome. It's the best technology used right now for kickstarting the healing process of partial thickness and full thickness challenging wounds. I'm sure you guys see a ton of chronic wounds, don't you?" "Yes." "Well, that's what this is for. DFUs, VLUs, and any wound you see that needs help granulating tissue in a quick time frame." Once you get a lunch, amazing. You're almost there. You've done the hard part. Please remember that usually reps don't show up empty handed. After you've closed for lunch, usually you'll ask what the staff wants for lunch or for coffee. And trust me, once you close the deal, you'll make money hand over fist. During lunch, go over how Dermabind is applied and dressed, which wounds it can be used for, and tell them, depending on their comfortability having reps in the office, that you'll absolutely be there for their first procedure to make sure all goes well. The doctors already understand that allografts are not investigational technology. Once you've sold the doc and promised to come to the first few procedures, you then talk to the back office about reimbursement, talk to the doctor too, and show them that the sheet will give you about what the office gets reimbursed per placement of the graft. Make sure you tell them that they will have the full support of our reimbursement department, who will walk through every step of the process with them, making it seamless for them to bill. This is when they'll typically do the math, and they should understand that they get better reimbursement for this than any other graft on the market. When you've closed the deal, the administration will then have to fill out a new provider onboarding form, which is simple. We just need some accounts payable information and claims processing information in order to bill properly. Go to reimbursement at healthtechwc.com to bill Dermabind TL or FM per the World Reach Health Patient Support Program and insurance verification form. Administrators are extremely used to doing so and shouldn't seem put out. In fact, ours is extremely foolproof. Please make sure when or if you provide lunch that you follow these next set of rules for the Physician Payment Sunshine Act. The Physician Payment Sunshine Act requires medical product manufacturers to disclose payments or transfers of value they make to doctors or teaching hospitals. This information is publicly published in a database. You need to get doctors' MPI numbers, which is public information. You can get it online for reporting purposes. Any lunch or coffee that's less than $10 per person doesn't need to be reported, as well as any staff and just office members are not reportable. Happy selling.